Are you struggling with migraine headaches? If so, you are not alone. Migraines affect millions of people worldwide and can be debilitating. Migraine is a neurological disease that affects about 12% of the general population, with women being 2 to 3 times more likely to suffer from it than men. This condition is usually genetic and is more common in people aged 30 to 39 years. Migraines have 4 different stages, which include the prodromal stage, aura, headache, and postdrome. During the prodromal stage, a person may experience constipation, depression, diarrhea, drowsiness, food cravings, or irritability 1 to 2 days before the headache. Recognizing these symptoms can help a migraine sufferer take treatment before the full-blown attack begins. Aura is present in about 1/3 of migraine sufferers. The most common type of aura is visual, which includes flashes, dots, shimmers, or zigzag bright lights. Other types of aura include sensory, motor, and learning or speech difficulty. The headache associated with migraines is often unilateral, throbbing in nature, and exacerbated by physical activity. It often causes photophobia, phonophobia, nausea, vomiting, and sensitivity to touch. During a migraine attack, the trigeminal nerve becomes activated and causes pain in the structures it supplies, including the eye muscles, face, and dura mater that surrounds the brain. The headache can last from 4 hours to days. In the postdrome phase, patients can experience transient headaches upon sudden head movements, exhaustion, and fatigue. Retinal migraines are characterized by the loss of vision in one eye that occurs temporarily and is followed or accompanied by a headache within an hour of the visual symptoms onset. The vision loss occurs intermittently and typically affects only one eye, lasting for brief periods of up to 20 minutes before gradually returning. However, any instance of vision loss should be assessed and evaluated for more serious eye conditions, such as retinal detachment, stroke, due to decreased blood flow, or tumors. Patients with retinal migraines need to receive a proper medical evaluation to ensure that any underlying conditions are identified and treated appropriately. Triggering factors of migraine. Foods, milk products, sugary food, food additives like MSG. Stress and anxiety. Caffeine, high intake or withdrawal from coffee. Weather changes. Sleep patterns, irregular or too much sleep. Menstrual period and menopause. Environmental factors, bright lights, loud noise, strong odors. Dehydration and dry eye syndrome. How to manage migraine headaches. First and foremost, if you experience throbbing pain or visual aura during a migraine attack, it's essential to avoid driving. Additionally, try to identify and avoid any triggers that may have caused your migraines, such as certain foods or environmental factors like bright lights or loud noises. Ensuring that you sleep well, lead a healthy lifestyle, and remain hydrated can also help reduce the frequency and severity of your migraines. During a migraine attack, eating fruits, vegetables, and rice can help as they have anti-inflammatory properties. Over-the-counter pain relief medication can also be helpful, as can lubricating eye drops if you experience eye discomfort. In terms of treatment options, there are both abortive and prophylactic measures available. Abortive treatments aim to stop a migraine attack that has already started, while prophylactic therapy aims to reduce the frequency and severity of migraines over time. For mild to moderate migraines without nausea or vomiting, non-steroidal anti-inflammatory drugs, NSAIDs, like aspirin, naproxen, ibuprofen, or diclofenac can be used. For moderate to severe migraines, triptans or a combination of triptans with NSAIDs can be effective. In cases of severe migraines with nausea and vomiting, Sumatriptan, antiemetics, dopamine receptor blockers like metoclopramide, prochlorperazine, or chlorpromazine, dihydroergotamine with metoclopramide, or ketorolac can be used. Prophylactic therapy is recommended for patients who experience frequent migraines that impact their quality of life. Beta blockers like metoprolol or propranolol, antidepressants like amitriptyline or venlafaxine, or CGRP antagonist, monoclonal antibodies, injections are some of the agents used in prophylactic therapy. Remember, a migraine is not just a headache, it's a complex neurological disorder that requires proper diagnosis and management. If you experience any visual loss or blind spots, it's essential to consult your doctor immediately. In summary, migraines can be challenging to manage, but by avoiding triggers, staying hydrated, and using appropriate medication and treatment, you can reduce the frequency and severity of your migraines and enjoy a better quality of life. Thanks for watching. Subscribe to the channel for more eye-related content.